My name is David Jansen, and I'm going to talk with you today about liposuction. Liposuction is probably one of the most poorly understood of the procedures that we do in plastic surgery because it's been covered on television so poorly and so archaically as to not represent what we do. Liposuction is an incredible tool that's been developed in France and is now used widely in the United States. When it was originally developed, liposuction was basically putting a patient under a general anesthetic, putting in a large bore tube, and removing fat. The fat removal was, quote, a blue jean operation, not a bikini operation, because the large tubes utilized left grooves and divots and unevenness of the skin that left patients with a very unacceptable cosmetic result after this procedure done, which was for cosmetic reasons. The difference in liposuction really has come in the last 10 or 15 years, even though most depictions on television are of old-style liposuction. The difference starts with pre-filling the fluid, pre-filling the area where you're going to do liposuction with what we call tumescent fluid. It's really intravenous fluid with a very dilute amount of local anesthetic and a medicine called epinephrine, which drives the blood out of the area. By putting that fluid into the area that's going to be liposuction and waiting 15 or 20 or even longer minutes prior to doing liposuction, you can do a liposuction procedure in many patients under purely a local anesthetic. We do this in our office for relatively smaller volumes, 4 pounds, 5 pounds worth of liposuction. Patients who need more may want to do it in an operating room, or if it's a very sensitive area like men's backs or women's backs, men's breast areas, sometimes doing it under an anesthetic works better just because of the local. But liposuction done under tumescent anesthesia is really painless and, for the most part, bloodless liposuction. The next great advance besides tumescence is the use of small cannulas. By using really small liposuctions, smaller than a pencil, smaller than a pen, the tubes used then don't cause rippling and grooving because you don't remove any large amount of fat with any one pass of the device. The device passes through the tissue, it passes around the nerve and around the blood vessel because it's small caliber, and the nerves and the blood vessels tend to be resistant and don't get ripped. There's much less bleeding, much less bruising, and much less flaw of the skin afterwards. So it becomes a bikini operation instead of just a blue jean operation. It's not just large volume removal, but large volume finely removed. Very rarely seen on television. Normally it's a very aggressive type of procedure you've seen on television, and it is simply not what we tend to do. The other advent besides small cannulas for liposuction is the use of the power-assisted device. The power-assisted device is a handpiece that we put the liposuction cannula on. It vibrates back and forth only about 3 millimeters, a very short distance, but 1,000 times a minute. And as it goes back and forth with small cannulas and passing the device, much more like playing a violin than assaulting somebody with a stick, this device now allows us with power to get volume off with very precise strokes and passage, so it's much more like playing a violin and getting a much more even reduction of tissue thanks to preoperative marking and great experience doing liposuction. The last device I'm going to talk about to only say we have it, we use it, and we are board certified plastic surgeons who use this device, is the internal laser. The internal laser is great for heating the tissues below the level of the skin and getting the skin to contract a very little bit. In general, it doesn't work. It works very well for very thin skin, like in the submental area under the neck, the inner arm, and the upper inner thigh. But the vast majority of patients who have laser liposuction done on their stomachs or inner or outer thighs really don't need it. And so although we have it available and it is more expensive to do it, and we do the procedure, Laser assist for liposuction is best used for very selected patients and is not an answer for all cases. We now know in plastic surgery, it's the operator more than the device that gets the best result in liposuction.